हेलो एंड वेलकम बैक टू द पॉडकास्ट विद मी आई एम शीना पिल्ले। आज हमारे साथ डॉक्टर पवन कुमार है, हु इज द सीनियर हार्ट सर्जन एट ग्लेनिगल्स हॉस्पिटल, who has more than 35 years of experience and who has done 15,000 heart surgeries with a 99% of success rate. Welcome, sir. Sir, you have so many years of experience. I would wish that you share your experience and your journey.
It's a pleasure talking to you, Sheena. I've been in this field in Mumbai. I came in Mumbai in 1992. I've been practicing adult cardiac surgery for the last 36 years now, and I've performed over 15,000 heart operations. And out of that, last 4-5 years, that has never been a mortality. So it's a super safe heart surgery which I have performed.
So heart surgeries, people say that it is very scary. It's a myth कि सबको लगता है heart surgery बहुत डरावनी चीज़ है. What do you have to say about it?
Well, with over my 36 years of experience, I can say heart surgery is not at all scary. It is life-giving. I will say it is life-giving. You gain a second life, and it's a happy ending, in fact. So, if somebody has been advised heart surgery, he should not be scared of it, because the treatment course changes. It is the whole treatment is a destination therapy kind of thing. So, it is not at all scary.
So, sir, जिसको अगर हार्ट अटैक आया है तो इनको सर्जरी की जरूरत पड़ती है
नहीं, ऐसा नहीं है. एवरी हार्ट अटैक आने के बाद में हर किसी को बाईपास सर्जरी सजेस्ट नहीं की जाती. खाली 10% लोगों को ही बाईपास सर्जरी की जरूरत पड़ती है. इन लोगों का एंजियोग्राफी होता है. एंजियोग्राफी करके पता चलता है यदि इनको ट्रिपल वेसल डिसीज है, कोरोनरी आर्टरी डिसीज है, तो उनको बाईपास सर्जरी की जरूरत पड़ती है. जिनको डबल वेसल डिसीज, सिंगल वेसल डिसीज है, उनकी तो स्टेंटिंग हो जाती है, मेडिकल मैनेजमेंट हो जाता है. पर आजकल देखा जा रहा है कि लोग मल्टीपल स्टेंटिंग कराते हैं और वो स्टेंट्स फेल होते हैं, तो उसके बाद में उनको बाईपास सर्जरी की जरूरत पड़ती है. वैसा ही हर हार्ट वाल डिसीज के अंदर वाल रिप्लेसमेंट या रिपेयर की जरूरत नहीं पड़ती, क्योंकि बहुत समय तक के ये डिसीज अपने बॉडी में आप उसको एडजस्ट करते रहते हैं. एक समय आता है, एक इंडिकेशन आता है जब वाल बिल्कुल ही खराब हो जाए, बहुत ही ज्यादा लीकेज हो जाए, बहुत ही ज्यादा नैरो हो जाए. उसके हमारे साइंटिफिक इंडिकेटर्स हैं, उनको हम फॉलो करते हैं. उसके बाद में हम एडवाइस करते हैं कि इनका वाल का रिप्लेसमेंट होगा या रिपेयर किया जाएगा. और वैसा ही हार्ट फेलियर डिसीज के अंदर है, जिनका हार्ट का फंक्शन 1% से कम हो गया है, तो हम साइंटिफिक उसको स्टडी करते हैं, इनको बाईपास सर्जरी की जरूरत है या नहीं है. उसके बाद में डिसाइड करते हैं कि इनका हार्ट फेलियर सर्जरी इज रिक्वायर्ड और नॉट. सो ऐसा नहीं है कि हर किसी को हार्ट सर्जरी की जरूरत पड़ती है. साइंटिफिक प्रोटोकॉल्स हैं, साइंटिफिक डिसीजन मेकिंग प्रोसेस है, उसके बेसिस पर हम लोग आगे उनको हार्ट सर्जरी सजेस्ट करते हैं, ताकि उनको हार्ट सर्जरी से फायदा हो.
So one more question, कि हार्ट सर्जरी इज इट रिलेटेड टू एज? बिकॉज आई हैव सीन पहले जो भी थे, जो एजेड लोग हैं, उनको ही सर्जरीज, हार्ट सर्जरीज वगैरह पहले लगती थी. अभी सबका लाइफ सेडेंटरी हो गया है, सबको अभी आजकल आई हैव सीन यंग पीपल अंडरगोइंग सर्जरी. सो व्हाट डू यू हैव टू से ऑन दैट?
एब्सोल्युटली करेक्ट. प्रीवियसली हमारा जो अनुभव है 90s और 2000 के उसमें, तो यूजुअली हार्ट सर्जरीज वर restricted to 50 year onwards to 60 years, 70 years or so. But as हमारा lifestyle बदल रहा है, young people are smoking, drinking and junk food खा रहे हैं, कुछ genetic factor भी है, hypertension भी होता है, तो younger age के अंदर, last week में I have operated 4 patients, those who are less than 40 years age. One of the patients I operated yesterday, so which is of 39 years. उनका coronary artery bypass surgery करना पड़ा. Extensive diseases occurring. Ladies are also getting in heart attack in their protective age group of between 20 and 45 years. Even they are getting heart attack, so they also have to undergo coronary bypass surgery. Similarly, valve disease is also catching other spectrum of the life, where degenerative disease is becoming common. So aortic valve degenerates, mitral valve degenerates or calcifies. So after 70s we have to replace the valve. So this kind of new spectrum has come up who require heart surgeries now.
And congenital heart?
Well, congenital heart disease is basically first decade of the life, where congenital heart disease is detected and treated, and which is also now more and more diagnostics have come with the better equipments, so we catch congenital disease early in the life and we treat them. And it has become one of the successful stories of surgical success for the treatment purposes, because congenital heart disease has become almost curable now.
And as a surgeon, when do you suggest they should undergo surgery if somebody is having congenital heart disease? What is the time frame?
Congenital heart disease, it all requires proper understanding of heart disease. Whether this has become perfect time for intervention. Whether intervention will give him total cure. So that is basically investigated by echocardiography, cardiac catheterization, and cardiac MRI. So that's how we know that this baby has become correct candidate for corrective heart surgery.
And so, what are disease conditions that require heart surgery?
Well, there are plenty of heart diseases which require heart surgery. One is heart attack disease. Most common is coronary artery disease or heart attack disease, for which we do coronary bypass surgery. Then we have heart infections like rheumatic infections, which affect heart valves. So we do aortic valve replacement surgery or repair surgery, mitral valve repair or replacement surgery. There are 4 kinds of valves which heart has. For that we require a heart valve surgery. Then there is a congenital heart disease. By birth, heart defects are there, for which we require to do heart surgery for correction purposes. Then there is a arrhythmia surgery, heart arrhythmia surgery. Then heart failure surgery as a therapy. So these are the things which we perform for heart diseases.
And so, what kind of surgeries are done in a complex situation?
Well, there are plenty of complex situations which we face. It's not a smooth heart surgery. We may have a person who is as old as 80-year-old, a person who may be on with a renal failure, person who may have lung disease, a patient who has had a stroke, or person who has very low heart function, like less than 25%. And if we are asked to perform heart surgery, these are the complex scenarios under which we perform heart surgeries. As you know, Gleneagles Hospital is in fact quaternary care center. From all over the world, from all over India, patients come with the complexities in their body, and we have to perform heart surgery. They are advised to undergo heart surgery. That's how we come in the picture.
So, as far as your experience is concerned, how do you consider that this heart surgery is safe?
Heart surgery has had mortality in earlier days, in 90s, but gradually we evolved the protocols, different schedule how to make person fit to undergo heart surgery. And then according to these strict protocol following methods, we have made heart surgery absolutely safe. It may not be inappropriate to say that over the last 4-5 years I have not had a single mortality. In whichever hospital I operated, whichever place, whichever kind of condition person had, all patients underwent heart surgery safely and went home.
जैसे बहुत सारे लोगों को हार्ट सर्जरीज एडवाइस करते हैं and they are scared, what advice would you like to give it?
Yes, this very important question. All those people, those who have been asked to undergo heart surgery, they must prepare their body. They must know their disease. They must know their symptom. They must know their organs, different organs, whether they have any kind of disease in your body, if they are highly diabetic, let them control their diabetes, improve their lung function status, see how the liver is functioning, how kidney is functioning, get all the organs in optimized state to undergo heart surgery.
Okay. And what expertise you would like to give to people for their recovery and a success rate of post surgery?
Again, another very important question. A person who has to undergo heart surgery, first thing is that he must get his body optimized to undergo heart surgery. Because once the heart surgery is done, he has to control his risk factors. Like if he was smoking, he should quit smoking. If he was taking a lot of bad diet, he must control his diet, follow the medications properly, and at the same time, whatever the modifiable risk factors are there, they should modify. So that will give him the great long-term success rate. That is very important for all patients, those who have to undergo heart surgery.
And any advice from your side to all our viewers, because अभी heart surgery अगर disease है तो करना ही पड़ेगा. Just in case to avoid that, how to keep themselves healthy and to improve their lifestyle. Can you just give them some tips?
Before that, I would want to tell them that if they have been advised heart surgery, like if they have undergone angiography for their angina and they come out to be triple vessel disease, then heart surgery is advised. Coronary bypass surgery is advised. If valve is damaged, too much damage has occurred, then he or she may require valve replacement surgery. And if there are any other complex issues like poor heart function, but then again other therapies have failed, they have been advised bypass surgery. Like they have undergone many stenting procedures, stents fail. So after that we have to do bypass surgery. So all these things are very important points. These people should keep in mind that heart surgery is a destination therapy. It's a one-time job. If done good in expert hands, in expert settings, good hospitals, it will give you great success, great long-term success. So that is where you not only save money, it's a super saver, not only super safe, heart surgery is super saver because you don't have to undergo repeat hospitalization. Your expensive medications are avoided.
Correct.
Repeated procedures are avoided. So you have gained next 25 to 30 years of 40 years of safety, security and long-term happiness in your life.
Correct. So, देखिए दिल तो सबको बचा के रखना है, हमें भी बचाना है. ध्यान रखिए अपने दिल के लिए. सर्जरी कराने की जरूरत जिसको भी है, प्लीज डरिए मत. इट्स वेरी सेफ एंड लाइक ही सेड इट्स अ सुपर सेवर. सो डोंट जस्ट वेट एंड अपने दिल का ख्याल रखिए. जस्ट टेक केयर. थैंक यू.
Thank you very much.